Hi, everybody. My name is Becky Lindemann. I'm a physical therapist with the Recovery Project, and I'm so happy that you're joining us today. Want to make sure that you know we're talking about bone health and what that means for you. And just want to make sure that if you're interested in this topic, you share this with others on your own page so we can get the word out on what's important about bone health, what you need to do to make sure that your bone health is the best it can be, and what to expect if you have poor bone health and need some treatment. So we'll talk about all those topics today. So under the topic of bone health, we look at whether or not someone's bone density is strong. As we age, you can develop a reduction in your bone density, and there's a couple diagnoses that might fall under. One is called osteopenia, and one is called osteoporosis. So osteoporosis is a disease where your bones are fragile and you're at risk for fracture. The process for osteoporosis can begin early in life, and it's considered more of a silent disease. So by the time people identify that they have weak bones, it's usually by a fracture, or the doctor has identified it as we've advanced in age. And so by that time, the best we can do is make sure that we're keeping people safe with good posture and good balance to prevent any kind of break in the bone. But really what we want to do is educate people before they get to that point to make sure that you're keeping yourself strong and healthy all through your lifespan, so that when we start to age and get more advanced in our age, we are prepared with healthy bones to enjoy that phase in our life. So what we know about bone health and bone strength is that we develop the density in our bones from when we're born through our 20s. So our body is taking the nutrients that we receive. It's responding to the kinds of demands we put on our bodies, and develops the strong bones that we need for what our physical activity looks like. So we are hitting our max bone density by the time we're in our 20s. Once we get into our 30s, we start to plateau in the strength that we have in our bones, and we start to see a slow decline, very small in your middle ages, but starts to increase as we get older. So for everybody's reference, if you're under 65, the doctors are not recommending that you do any general screening unless you have certain factors, which we'll talk about. But if you are over 65, you should have a family practice doctor or an internist that you see on a regular basis, and that would be a great person for you to discuss. Are you getting the proper screening to make sure you have good bone health? And that would include a bone scan. So everyone who's 65 or older should get a baseline bone scan from their physician, and then talk with them about what kind of regular screening would be required. The bone scan itself is normally called a DEXA scan, and it's something that's very common. It's non-invasive, it's not painful, and it's a great way to know if you're at risk for any other issues. If you're under 65, a bone scan may be recommended for you if you have some sort of endocrine disorder, a metabolic disorder, if you are a smoker, or if you have a high alcohol intake in your life. Other things that put you at risk for bone health issues would be certain medications and their side effects. If you are generally in a very low BMI, so if you have a lower weight, you could be at higher risk for bone density issues. Rheumatoid arthritis, or anything where you're required to take long-term steroids, can have an effect on your bone health. So if you are seeing your doctor regularly, they will be able to tell you whether or not you need to get a scan earlier than 65. If you treat with an endocrinologist, on a regular basis. You may have a condition that would benefit from a bone scan to make sure your bones are remaining healthy. So that would be the recommendations for screenings. And then there are things that you can do to make sure that you're safe and healthy if you know you have osteoporosis or osteopenia. So when the doctor does the screen, they're going to give you a score, and it's called a T-score. And the T-score tells you how healthy your bones are compared to someone, say, in their 20s. When they give you that score, it should be less than 1, meaning that your bones are in great shape. If your bones are between a 1 and a 2.5, there's been some weakening there, and that's a great time to make sure that you're getting the nutrients you need to slow down that loss of bone, to make those bones as strong as possible. And if you're at a 2.5 or higher on that T-score, that's when you want to work closely with your doctor to see what treatment options are available to you to make sure that you're reducing that bone loss as much as possible, that you're keeping yourself safe from fracture, and that's where therapy can come in too. So there are medications that the doctor may recommend for osteoporosis. We are not, as therapists, experts in meds, so I would send those questions to your doctor. But there are some meds that you can take that help with that. And as we move forward with research, there's improvements in the meds and other meds available. Some of them you want to take on a daily basis. Sometimes they can recommend an injection that you would get a couple times a year or once a month. So that's something to work with your doctor on. They may recommend certain nutrition that you want to make sure you get. We know that you want 1,000 milligrams of calcium every day in your diet to make sure your bones are as healthy as possible. If you're over the age of 50, we want to increase that dosage to 1,200. So again, a great thing to ask your doctor about if you're curious if you're getting the right amount of calcium. They're going to tell you what your specific recommendation would be based on your medical history. That's why it's always great to have a doctor that you're working closely with on a yearly basis or more frequently. As far as therapy goes, I think, and I know that physical therapists have a lot to offer for protecting someone's bone health and making sure that you're safe from fracture. One of the things that we work on a daily basis in physical therapy is fall risk. So when we have someone come in who has osteoporosis or osteopenia, one thing we want to get a great handle on is, does someone have good balance? We know when you hit 65 that we are recommending fall screens. It's just that time in your life when you want to make sure you're feeling steady on your feet. And it may not be something that would happen just on a regular tile floor, but maybe you're in the grass now or you're walking on a sidewalk and you're just not quite feeling as confident as you could when you're walking out in the public. So we look at fall screen and we give people balance exercises. Balance exercises are strongly recommended for people with bone density issues. The other thing we look at is posture. So spine posture, where your head positions over your shoulders. Do you stand and sit with your chest up? Are you able to extend your spine all the way, or do you feel like you're stuck in a forward position? The therapist will look at that if you have any kind of bone density issues, because that can be common in the spine. And if we are seeing some deviation from normal in your spinal alignment, we're very equipped to give you exercises to strengthen the muscles around the spine and really help you to realign yourself in a nice straight posture. The reason we want to do that is because if your shoulders and your head are falling forward, that's extra pressure on those vertebrae, and that can cause fragility fracture. So if we can get you as straight as possible and work on your extension of your spine, then we know that that's going to reduce the strain on your spine, and that's going to help with your longevity. dealing with any kind of osteopenia or osteoporosis. So those are the two factors that we really focus on in therapy for bone health, would be posture and fall risk. The other thing that we know is really helpful for improving bone density and reducing bone loss is gentle strengthening, so resistance exercise. So if you have any bone health issues, you know of anyone who has any bone health issues, then they would want to come in, get treated for the balance and posture, and also for some resistance exercises. So what that means is using small or light weights or resistant bands to strengthen the muscles on the limbs. So arm and leg muscles, we're talking about biceps and triceps, so the upper arms, the forearms, the thighs, the lower legs, making sure that someone has the strengthening exercises they need to keep those bones strong. One of the things you may not know is that the bone responds to the amount of muscle pull that occurs, and if there's a lot of muscle pull on a bone, the bone's going to respond by increasing the mineralization and becoming stronger. So we'll add those strengthening exercises because it gives the bones and the body the signal that we need to make those bones stronger, and that can be helpful at any age. The great thing about our therapists here at the Recovery Project is that we're all trained in how to dose exercises and resistance and the number of repetitions and the frequency you need to do them to make sure that you're maximizing your strength, you're giving good, safe input to the bones so that you can get long-term improvements in that bone health. So it's great to have a whole team working on this area if you have some diagnosis like osteoporosis or osteopenia, because there are definitely things that you can do to improve this condition. Let's see. For home recommendations, you may have some home exercises already that you know you do. You might be an active person and someone who really enjoys fitness. So if you do and you're looking at ways that you can include exercises in your current program to make sure you're addressing your bone health, make sure you're getting your agility exercises and your balance exercises in 20 minutes a day. Make sure you're spending 10 minutes working on your posture. So working on those back muscles and stretching out the chest and making sure that you feel like you're in the best alignment you can. So there's a good trick you can do if you're curious about how your posture looks, is you can go and stand up against the wall. So if you can get your heels and your hips against the wall and you can get your shoulders and the back of your head, so like where your head meets your neck, if you can get that all to touch the wall at the same time, then you're in great shape. So your posture is normal and perfect. Sounds like a great start to when you want to get those exercises in so you don't lose that posture. If you can't get your head to touch the wall when your feet and your hips are back there, or you can't get your shoulders to pull back, start working on it. If it's something that you're not able to change yourself, maybe that's a good signal that you should get a prescription from your doctor and come in to see a therapist. You don't have to spend a lot of time here. You could come in for a couple weeks or more and get your home program and take it with you and start making those changes yourself. So we recommend 20 minutes of balance at home. We recommend 10 minutes of posture work at home, and you could do 30 minutes of strengthening exercises 3 times a week. And that would be really great to help your bone health, along with all the other systems that exercise benefits. If you're not into that type of fitness and you're still wondering what else can I do at home to help with my bone health, walking. We all know that you want to get in that 10,000 steps a day. Maybe that's a lot for everybody, but you could start with 2,000. Get 2,000 steps in a day and start working your way up from there. But if you get 5 to 10 minutes of true, like dedicated walking exercise in a day, you're definitely going to help with that bone health in your legs. Also, if you're getting that active walking in, You're going to reduce that fall risk, keep yourself agile, and that's always recommended.
So when we're talking about bone health and the importance of our bones, you talked a little bit about exercise. Now, is there any particular type of exercise that someone that's 65 years old that's at home can do on their own?
Sure. So we recommend things like weight-bearing exercises. So if you can just do repetitions of getting into a chair that you can easily stand up from and doing repetitions of that, that would be great for strengthening the legs. It doesn't require any equipment, anything like that. And you can do, start with like 10 to 20 reps and see how many you can get in and work up from there. If you can do anywhere from work your way towards 50 reps and your knees feel good, your hips and your back feel good, that would be great. So if you get to the point where that's tough for you or painful, again, that would be a time when we would recommend you come in and have a therapist guide you through that exercise. So sit to stands are fantastic. Climbing stairs are also great for strengthening the legs, something really easy for you to do at home. You know, other things that you can do are trap rows. So with a trap row, you can sit up tall. If you have a resistance band, you need a tool for this. So you need one of those stretchy bands, and you can pull back and work on resistance of those trap muscles. And that's going to help with opening the chest and strengthening through the shoulder blades. So those are great exercises to do at home.
Okay, so we do have a question. Does the Recovery Project have any group exercise classes that someone can attend to improve their bone health?
So we have a great general exercise class called Be Well, and that's a group class that anybody can join, and it includes agility, so that would be some balance exercises. It includes some strengthening and resistance exercises, and then some flexibility. So while it's not an exercise that targets bone health, I think one of the messages we wanted to relay today was that by doing things that you would normally do in a fitness routine, you are benefiting your bone health as well. And so that would definitely be beneficial for someone who's having concerns.
So another question would be the importance, when we talk about, again, the importance of bone health, a lot of people don't really consider exercising your bones. So you talked about muscle and being able to, for the muscles to release minerals. Can you talk a little bit more about that?
So there's a lining on our bones called the periosteum. And in that lining are cells, live cells that help to build up bone and break down bone. So the body's always working towards remineralizing and demineralizing bone, adding cells to the bone, restructuring the forces that the bone is responding to. So that's all on a scientific level, cellular level happening. But the way that happens is the muscles, as we know, attach directly to the bones on that periosteum. So when you contract a muscle with exercise, especially with resistance exercise where you're adding a little extra weight and you're putting a little extra demand on those muscles, when you do that, that muscle pulls on the bone in the periosteum and it signals the body and those bone cells to re-strengthen the bone. We often in physical therapy use the term use it or lose it. So if you use those muscles and pull on those bones, the bones are going to respond and say, oh, well, I need to strengthen myself so that I don't break, right? So when you do the resistance exercises, it gives the bones the input that you need to strengthen. If you don't do the exercises, then that's when the bones start to demineralize and they weaken.
So I noticed also too in your talk today, you talked about post-menopausal women and men between 50 and 64 that also have a risk of fracturing as well. And why is that?
So a lot of our bone health is influenced by our hormones in our body. So when women go through menopause and their hormone balance changes, it will affect the bone health as well. So one of the factors that the doctors look at when determining what someone's bone health risk is, has a woman gone through menopause? Because once you do that, then automatically the hormone balance in your body changes, and then you're at a higher loss for bone after that. So that's why that 50 to 64 range, if you've gone through menopause at that point, that might be a time when they want to check your bone health. They may look at different factors and see in totality if you're at a high risk for bone density issues. And then that a final cutoff for bone density check is 65. Most women, a lot of women have gone through menopause by that point.
Okay. So, and then also, what can caregivers look for with respect to their patients or the people that they're giving care to, maybe at a risk for falling because there may be some issues with their bones?
Yeah, so one of the things is when your bone density gets pretty low, any kind of changes that we can make to improve bone density are going to happen a little bit slower, and it's going to take some time. So if we've identified someone who has weak bone health, and so if that's for a caregiver who's caring for someone with weak bones, the priority there is keeping them from falling. So caregivers should make sure that their loved one or their client are doing the proper exercises that are going to help maintain or improve their bone health. They're having it managed by a physician on any appropriate meds. And then the caregiver's responsibility would be to make sure that their loved one or client is safe when they're walking. If the therapist has recommended that they walk with assistance, that assistance is consistently given. And we just got to keep anybody with bone density issues from falling, because we don't want those fractures.
Is there anything else that you'd like to add?
Oh, I don't think so. I mean, I could probably talk all day on this subject, but I think I've shared enough for everybody to process today. So thanks everyone for joining us. I hope you found this helpful. Feel free to email us or Facebook us or Instagram us at The Recovery Project. If you guys have any further follow-up questions, we're always here. Thank you.